Hi, my name is Jeanette Blackstock. I'm a PTA student that's working with a 22-year-old female that sustained a closed severe brain injury due to a motor vehicle accident 4 weeks ago. She also sustained a left parietal subarachnoid hemorrhage and a right temporal parietal hemorrhage. Patient also has a tracheostomy intact but is not present in this video. She also contracted MRSA while in the acute hospital rehabilitation center, so she is on PPE precautions. The patient does not have any past medical history before this injury, but now she's on multiple medications to help with DVTs, aggravation, and help with the MRSA. She also presents a level 2 emerging level 3 on the Rancho Los Amigos scale, so she can only move her eyes with auditory and visual stimuli. So during my intervention, I will use her hands to facilitate eye movements, and she's also not verbal, so I'm still going to speak to her as though she is verbal, and I'm going to treat her like I would any other patient. This patient is also dependent in all mobility and also has normal functional limits with range of motion, but she does have decreased posterior and inferior glides of the glenohumeral joint on the right side, and also she has 15 degrees plantar flexion contractures in her ankle and knee extension contractures. So the limitation in activity that I chose to focus on is increasing her range of motion with passive PNF D1 flexion patterns to help prevent contractures, and because it's unlikely the patient is able to move or going to move anytime soon, so I'm going to step in and help with doing range of motion to all 4 extremities to help prevent contractures and increase her range of motion, so when she does finally move up in the levels of function, she'll have more range of motion. And we will also I will also address increasing range of motion in the shoulder of the glenohumeral joint to help increase range of motion and prevent limitations in range of motion to be able to return to recreational activities and work activities involving overhead reaching and behind the back with shoulder flexion and abduction, because she was an assistant in her college and she also likes outdoor activities and recreational activities that she does prior to her injury. So I will address the decreased posterior and inferior range of motion by doing joint mobilizations to the glenohumeral joint with posterior and inferior joint mobs to facilitate flexion and abduction of the right arm while she is in supine due to the patient being a level 2. And I also chose a PNF D1 flexion pattern to both upper extremities and lower extremities to prevent contractures, and also have the patient try to follow my hand again to incorporate alertness by getting her to track her hand and both hands to work on her auditory and visual stimuli. So please enjoy my video, and I'll show you what we'll do. Thank you. Hi Jordan. Hi Jordan. How you doing? It's Jeanette from therapy. I'm gonna work with you today, okay? I'm gonna take this blanket off of you. All right. So I see where in your chart that you have some pressure ulcers behind your feet. So I'm gonna get this towel roll and I'm gonna put it underneath your feet to get some air to them, okay? All right. do today is I'm gonna see how much range of motion we have in your arm. So I'm gonna see how far we can come up and how far we can come out to the side. And then we're gonna, I'm gonna put some do some joint moves to increase that for you, okay? Because we don't really move just in one plane or the other plane. We move in all 3 planes, not even thinking about it, okay? So let's see how far you can go. Okay. All right, so we can go around here. Let's see if we can get you a little further. All right, so I'd say we got about 80% of range of motion. We're gonna try to get you, the normal is 180, so let's go maybe 100, okay? So I'm gonna do a posterior joint move right here. How you feeling, Jordan? Is that okay? It cause any pain? All right, let's see what we have now. Okay. Let's do a little more. All right, let's try it again. All right. One more time. Nice, Jordan. Good job. So we want to increase this so we can have more functional use for it later on, okay? And then we can build off of what we have and make even stronger and better, all right? So also, let's gonna work with your arm coming out like this. So I want to see how far you can come out. Inferior joint moves. All right. So now what we're going to do is we're going to do PNF patterns across your body because we want to reach things from both sides. We want to increase that. And also when I bring your hand over, I want you, can you see your hand, Jordan? Can you see your hand? Nice. Now I want you to follow while I move your arm, okay? So we're going to go across your body as far as you can. Good job. Follow that arm all the way out. Good. Good job. Let's see those eyes. Time. Okay, so now what we're going to do is we're going to move these legs down here, okay? So I know we have a contracture, so I'm going to pull you as far as up as we can, okay? And then you just let me move your leg, okay? We're going to come up and back down. We're going to come up back down. Does it feel okay, Jordan? You're doing good. Nice. Now I'm going to put this side up over here. I'm also going to stick with this leg as well. We're going to start with this side and then we're going to come up to your arm, okay? So I'm going to bring your foot up and come up and over. Nice. Good job, Jordan. here? Can you see your hand, Jordan? Nice. I want to put all the way across your body as far as you can. Good job. Follow that hand all the way out. Good. Follow that hand all the way over. All the way out. Follow this hand. Good job. I see you. Does that feel okay? Follow that hand. I see you. Good job. Follow, follow, follow. Alright, so I'm going to keep this towel roll underneath your legs just to get that air flowing under there so we don't make your pressure ulcers worse. So we're going to keep that down here, and then we're going to get keep working on your coming across PDF to increase your movements, and then also your joint moves. So we want to make sure your arms not just going in one plane, and we want you to get full range. We don't want to get just halfway. We want to get you back to where you were before, okay? So I'm going to put this back on. Alright, Jordan, thank you for letting me work with you, and I will see you tomorrow, okay?